This press conference was called to apprise the nation on the progress made in implementing the far-reaching and extensive recommendation of the Health Ombudsman in trying to deal with the tragedy that befell the mental health patients from Life is Demanding. The Health Ombudsman released his report on the 1st of February 2017 at 11 hours with 18 recommendations to the state as a whole and 6 recommendations specific to the Gauteng Department of Health. Ever since the release of the report, there have been debates and statements over the media from political parties, civil society, religious leaders, and indeed members of the public. Many were coming up with their own verdicts and or proposals on what must happen. I want to take this opportunity to assure the nation that most, if not all, of the proposals that were made over the media in the past 2 weeks are actually covered by the Ombudsman recommendation in one way or the other. The remaining 22 NGOs that were housing patients from Life is Demanding have been assessed last week, as I've said, within that period of between the 6th and the 9th. And the recommendations from the task teams is that they will be closed immediately. I'm unable to announce their names. I've got them here, but I'm unable to announce them because we only received the report from the professionals and the technical experts last night, and these NGOs still have to be finally informed of their status by the relevant authorities. But to ensure the safety of mental health users, taking into account the concerns of the family, because, ladies and gentlemen, in everything we've been doing up to so far, we've been meeting with the families. We have not been doing anything alone because we want to know what is that which the families prefer in trying to de-establish this project. And so, taking into account the concerns of the families and the medical condition and status of the patient, the transfers out of NGOs and into care facilities will be systematic, will not be rushed, and planning will be meticulous. This, by the way, is the recommendation of the experts. The interest of mental health users is of paramount importance, and we dare not repeat the deadly mistakes of a hurried, chaotic, and hush-hush job as it has happened and led to this tragedy. So in our desire to reverse the tragedy, we were warned not to be overzealous and repeat the same mistake. So we'll follow a very systematic and well-planned, meticulous program. To this end, teams have also visited and assessed facilities that will be receiving the transferred mental health users. The facilities visited are both public and private. That means they've all been inspected for compliance. I need to mention this fact because there is also a narrative that we don't want to use private healthcare facilities, despite the fact that we have mentioned many times that we would like to. The private hospitals have been phoned over the past 2 weeks, and many of them clearly don't have any facilities whatsoever for mental health users. They do have beds, yes, but mental health users don't only need beds, they need something more than that, which is the first reason why the NGOs could not be able to handle them. And most of the mainstream private hospitals clearly told us that they are not in a position to help, but those which are like SDMN, which could be of help, have actually been visited and assessed. And I have to mention further, ladies and gentlemen, that contrary to popular sentiment, that we can just close this project by sending patient back to Life is Demanding even Life is Demanding, is no longer immediately available to accept this patient, because for a period of 9 months, they established their operations and they need time to prepare these facilities to their former condition. I've been in contact with the CEO of Life Health for the whole of this morning to discuss their state of readiness. And they believe they can only be able to take 75 patients within a week. The rest, they will need at least 8 weeks for preparation.